Oh, there we go. Okay. Walk into the patient's room, I would introduce myself and I would provide for privacy, pull the curtain. I would explain what we're going to be doing today, which is a head-to-toe assessment. I would wash my hands. Can you verify your name for me?
Zach Alton.
Okay. And what's your date of birth?
10/31/97.
Okay, and I verified that on the armband. Okay, just a general appearance. Patient is well groomed and has good hygiene. Patient is dressed appropriately for the season. I don't notice any abnormalities upon inspection. Alright, so for the head assessment, the head is normocephalic. It is symmetric. And I don't notice any lesions anywhere on the head. Okay, so we're going to assess your eyes first. Eyes are symmetric with the head. Okay, I'm going to shine this light in your eyes and I need you to look straight forward. Okay, eyes constrict with light. I'm going to put this up here, follow it with your eyes. Okay, pupils, what's the word I'm looking for? Eyes move with movement. Accommodate with movement. That's the word I'm looking for. Okay. I'm going to look up your nose. Okay. Nose is pink and moist and has no exudate. The septum is not deviated. Okay. I'm going to look in your mouth. Can you open real big for me? Okay. The mucosa in the mouth was pink and moist, no exudate, no excess dryness. The tongue was pink and moist also. All right, so now we're going to move down to respiratory. Are you able to sit up in bed for me? One, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, and 9. Okay, you can lay back down. And upon assessment of the respiratory system, I noticed that the patient's chest is not barrel chested. It's even and proportionate and symmetric on both front and the back. So now I'm just going to move your shirt to where I can easily get to your chest. And I'm going to listen up top. 1, 1, 2, 2, 3, 3, 4, 4, 5, and 5. Okay, so lung sounds were clear. No wheezes or any abnormalities noted. Okay, so now I'm going to listen to your heart. Do you have any chest pain? Okay. Okay, S1 and S2 heard, S3 and S4 not heard. No murmurs or gallops noted. Okay, so now I'm going to check your pulses. So your carotid pulse. Okay, patient's carotid pulse is 3+, it's strong. Patient's brachial pulse. Okay, patient's brachial pulse is 2+, and the patient's radial pulse. Radial pulse is 2+ and strong. Okay, I'm going to close your leg a little bit. I got to get to your femoral pulse. Femoral pulse is 2+. And then your pedal pulse, I'm going to have you kind of bend your knee here, that way I can get to your pedal pulse. And pedal pulse is 1+. All right. No edema noted to any of the extremities. Now I'm going to assess your abdominal. So I'm going to pull your blanket back down here. I'm going to raise your shirt. Okay. So we're going to listen first, starting in the right lower quadrant. And I'd listen for a full 5 minutes if I don't hear any vowel sounds. Okay, now I'm going to palpate, starting in the right lower. And then I'm going to listen one more time. Okay, vowel sounds are active in all 4 quadrants. All right. Did you have any tenderness or anything in your abdomen? Okay, good. All right, so now we're going to assess your strength and your flexibility with the range of motion. Okay? Can you grip my hand with your right hand? Good. With your left hand? Okay. Can you push on my hands? Can you pull on my hands? Good. Okay. Can you flex your arms? Can you extend your arms? Good. Can you rotate? Can you move them away from your body and bring them back? Good job. Okay. So push on my hands with your feet. Good. Pull back. Good. Can you bend your knees? Okay, you can put them back down. Can you rotate them inward? Good. Can you extend them outward? Good. All right. Okay. Now we're going to do some neurological. Okay, so patient is obviously A&O. He's verbalizing to commands. He's following through the commands that I ask him. Thought is moving. Okay. Now I'm going to assess your sensation. Okay, I want you to tell me if you feel a pain or a light touch. Okay, I'm going to do it in your arms and in your legs. Okay, so close your eyes.
Pain.
Okay.
Light touch.
Okay.
Pain.
Okay.
Light touch.
Good job. All right. Okay, so as far as the integumentary system, skin is pink with freckles. Skin is also pale. No wounds present anywhere on the lower extremities or upper extremities. No bruises, no lesions, nothing out of the normal. I'm going to assess your skin turgor now. Okay, I'm going to pinch on your chest a little bit. It shouldn't hurt. Okay, skin turgor is less than 3 seconds.
Yeah.
Just a general overall appearance for the integumentary system. Body is proportionate for patient's height and gender. So you should be good to go. Is there anything you need from me before I leave? All right, great. So I'm going to give you your call light. And I'm going to raise your bed rails. All right. And then I'm going to go wash my hands, and then I would document my findings.